joining us today. I'm going to be kicking things off, and I wanted to share a couple of housekeeping items before we get started. The first is that this webinar is being recorded, and a link to the recorded webinar, as well as a PDF of the PowerPoint presentation, will be shared with all of our registrants after today's webinar, so all of this information will be available later. The second is that you are welcome to submit your questions as we go. To send your questions in, simply type them into the on-screen control panel questions tab. We do not have audio capabilities for the presentation today, but you are welcome to type in your questions as we go. With that, I would like to pass it off to our first panelist, Liz Young.
Hi. Welcome to today's webinar, Sustaining a Culture of Health Through Workplace Policy, Partnerships, and Participation. I'm Liz. So I knew a person once. She had recently completed her master's degree in health and exercise science and nutrition and had familiarized herself with WellCoA's 7 C's of worksite wellness: capturing senior level support, creating a cohesive wellness team, collecting data, crafting an operating plan, choosing appropriate interventions, creating a supportive environment, and carefully evaluating outcomes. Within 8 months of graduating, she saw a position open up at a local municipality. It was a brand new position, that of a wellness program specialist. Although she was still rather naive when it came to the public sector, she was super interested in worksite wellness, and even more interested, some may say desperate, for a job closer to her home. So she applied, got an interview, and by the grace of God, was hired. Little did she know that she was in for a few big surprises. I'll let you in on a secret. This person, as you may have guessed, was me. The municipality was Larimer County, Colorado. My surprises, well, first I was surprised that employees were a rather tough crowd. Instead of being excited, like they should have been, right? Many, and perhaps most, were downright upset and skeptical of wellness arriving at their work. Secondly, I was surprised at how resistant people were to change. And third, I was completely overwhelmed by my quote-unquote responsibility to change the culture. Yes, that scary C word, culture. My wellness job was going to be much harder than I thought. Notice I said hard, not impossible. I'm guessing many of you listening right now might be able to sympathize with me. You believe in worksite wellness, want the best for your employees, and yet feel somewhat perplexed when it comes to actually embedding wellness into the culture of your organization. Hence, it's with this perspective that I've designed this webinar. We'll discuss how policy, partnerships, and participation, mixed in with programming and some time, can truly improve health and, yes, even culture. Be encouraged. It is indeed possible. So when I started at Larimer County, the year was 2008. It doesn't seem like that long ago, but a lot has changed in 7 years, mainly in terms of the research about and general support for worksite wellness. Take, for example, the article titled, "Workplace Wellness Programs Can Generate Savings," published in 2010 in Health Affairs, a leading peer-reviewed journal at the intersection of health, healthcare, and policy. You guys can actually download the article free from Harvard University's DASH repository, so the link is on the slide. Researchers did a thorough investigation of worksite wellness programs and found that medical costs fall about $3.27 for every dollar spent on wellness programs, and absentee day costs fall by about $2.73 for every dollar spent. In 2012, Larry S. Chapman, chairman and co-founder of Summit Health Management, released an article on the art of health promotion. The article discussed his findings after taking a systematic look at 62 studies that looked at the financial impact of workplace health promotion programs. And after his review, he concluded that evidence for the effectiveness of such programs continued to be strong, with average reductions in sick leave, health plan costs, and workers' compensation and disability insurance costs of around 25%. He said it was reasonable to conclude that worksite health promotion represents one of the most effective strategies for reducing medical costs and absenteeism. Hence, it's no surprise that worksite wellness is more widely accepted as a best practice today, even more so than just 7 years ago. And that reputable organizations such as the Health Enhancement Research Organization, the American College of Occupational and Environmental Medicine, the American Cancer Society, the American Diabetes Association, and the American Heart Association widely support worksite wellness. In 2012, these organizations even came together and released a joint consensus statement saying, research has shown that creating a healthy culture and work environment is a fundamental best practice for increasing employee engagement in healthy behaviors and health improvement. So you could say that one big hurdle is behind us. Creating a healthy culture and work environment through workplace wellness is accepted as a fundamental best practice. Yay. Yet, you could say that because of this, another hurdle lies ahead of us. The hurdle being figuring out how to actually create and sustain a healthy culture. I'm guessing you all agree that this is easier said than done. Before going any further, I want to ask you a few questions. The first being, does your municipality have at least one policy that supports a culture of health? Please answer using the poll option. Sweet. Looks like everyone has at least one policy. Oh, I guess I read the poll a little bit too quickly. I'm sorry. Okay, the number isn't quite 100%, but it's still pretty strong, with 67% saying they have at least one policy in place. We'll move on to the next question. Does your municipality have at least one partnership that supports your culture of health efforts? Okay, great. 3/4 of you do. A few of you don't. But don't worry, we will hopefully give you ideas for partnerships before the end of this presentation. The next question, does your municipality have a technique that's worked to improve participation in wellness initiatives? Okay, thanks for voting on that one. It looks like participation may be something that a lot of municipalities are interested in improving. And the last question is, could your municipality stand to improve wellness policy, partnerships, and participation? Okay. Well, I was hoping that we would have some interest in that, and hopefully this presentation will help with improving policy partnerships and participation in the future. So first we'll talk about policies a little bit. When it comes to wellness policies, there's always one that seems to rise to the top, both for need and for difficulty in creating and enforcing. It's the food policies, including foods at those meetings, events, foods in the vending machines, the foods available in the cafeterias perhaps. Well, for meetings and events, I think it's helpful to have criteria that is simple and memorable, such as when providing food at a meeting, aim for half being fresh fruits and vegetables, or water will always be available. These checklists with the criteria and suggested food options come in handy, especially for those people really responsible for organizing those meetings and events. And depending on your organization, the word policy might be a little too aggressive, and that's okay. Call them guidelines and make a healthy meeting declaration if you need to. Regardless, if you don't yet have healthy meetings in place, it's time. Make the healthy choice the easy choice. Don't let your worksite get in the way of people making healthy eating decisions. And as seen on the healthy meeting resource in front of you, it never hurts to show the cost comparison of healthier, fresher options versus the typical processed options. If you're wondering, it doesn't have to cost more. Simple tricks to budget-friendly foods and beverages include serving only water, skipping the desserts, and using smaller plates so people naturally take less. These strategies support the bottom line while supporting employees' waistlines. Policies for healthier vending can be important as well and can pose their own unique set of challenges. Resources such as Go, Slow, and Whoa can assist organizations who want to improve vending. Healthy vending machine vendors are also more common these days as well, and that helps too. Simply pricing healthier foods lower than their healthy or less healthy counterparts can improve vending machines and cafeteria food as well. Sometimes eliminating vending machines altogether is a viable option. And if vending is biting off more than you can chew, a completely different option could be to set up an on your honor healthy food station, like the one I've shown here. Use a refrigerator or a bookshelf. Stock it with some healthier options such as fruit or string cheese, tuna, and other items that employees like, and charge enough to cover the cost. Next, let's talk about policy options that support physical activity. These are important, as sitting has been dubbed the new smoking. One unique policy idea was developed by a municipality in Maine. It was called Sit for 60, Move for 3. The idea being to let employees know that it was okay, even encouraged, to get up and move for 3 minutes every hour. Using posters and senior level support, they marketed their policy and got employees off their seat and on their feet. Other policies that support physical activity include flex time policies, teleworking policies, and if you're brave enough, recess. Recess policies allow employees to take an extra 30-minute break if they use it for physical activity. Think about it. If employees took a 30-minute recess 5 days a week at work, they'd get their recommended amount of physical activity, which is 150 minutes a week. Imagine the benefits that could bring to people's health and to your organization. Regardless if these options are viable or not, it's always a good idea to simply remind employees about their lunch and 15-minute breaks and encourage them to use it. A formal effort from the top down to encourage leaders, managers, and regular employees to use their breaks is time well spent. Other ways to support an active culture include posting Use the Stairs posters, walking trails, adjustable standing workstations, which are much more affordable now than what they used to be, having bike racks available, and having accessibility to low or no-cost exercise facilities, either on site or in your community. Lastly, another quote-unquote policy that is important, but often skipped, is one that explains the wellness efforts in general. Often referred to as a wellness program charter, this guiding document states clearly the vision, mission, goals, overview, incentive criteria, wellness committee structure, and decision-making process for a wellness program. It gives employees, as well as those like you responsible for wellness efforts, clear parameters about the program. It brings order and sustainability to wellness efforts. Next, let's talk about the value that partnerships can bring to an organization's culture of health. Partnerships help sustain wellness programs by making them affordable, interesting, and validating. They help the program and the participants build a connection with the community and the numerous resources in it. Partnerships with your medical insurance administrator or provider, your employee assistance program, local health agencies, perhaps a local university, and local exercise facilities are definitely worth exploring. 3 more partnerships unique to Colorado include LiveWell, Way and Win, and Colorado HealthLink. As you know, LiveWell offers numerous resources, such as this Heal Cities and Towns campaign, to assist with worksite wellness efforts. Way and Win is a free program for Colorado residents that can be an asset to both the community and a worksite wellness program. Through the use of stationary or mobile kiosk units, it incorporates best practices for weight loss and actually pays participants to achieve a healthy weight. In fact, of the thousands of Coloradoans who currently participate, the average weight improvement after just 1 year is 8%. Because municipalities have the unique opportunity to serve both employees and citizens, they're a great place for a kiosk. And finally, HealthLinks Colorado is a resource you will likely start to hear more about if you haven't already. HealthLinks is a nonprofit initiative spearheaded by health and safety experts at the Center for Worker Health and Environment at Colorado School of Public Health in Denver. They partner with small businesses, private and public, to implement worksite wellness and safety programs and connect businesses with helpful wellness resources. And you might be interested to know, they offer a HealthLinks Healthy Business Certification, which is a program that recognizes small businesses and organizations for meeting or exceeding worker health and safety standards. And formal recognition like this seems to be really worthwhile because it gives credibility to your wellness efforts. Next, let's touch base on participation and how to increase it. In a nutshell, people participate in what they have ownership in. So you must first give them, your employees, the opportunity for ownership. An initial way to do this includes doing a health interest survey and culture audit. Ask employees what they are interested in when it comes to wellness at work, and use your input when you're designing their wellness programming. Let them provide input and feedback on the culture of health as well. Secondly, Give employees the opportunity to serve on a wellness committee and represent their department and coworkers. Leadership support for wellness is key to a culture of health. We all know that. But so is a grassroots support. A committee or two built from both the top down and the bottom up helps a wellness initiative move forward effectively and efficiently. And when it comes to participation, there can't be enough said for keeping things simple. Use an annual operating plan to outline the year's wellness offerings and any incentives involved. If there's an incentive, use a simple tracking card that corresponds with the operating plan as well, so people know how to earn the incentive. And adjust where necessary, but keep the structure somewhat the same year to year. Employees like to know what to expect. They want programs and opportunities that they can count on, not get confused by. The simpler we can make health seem, the better. Another helpful and meaningful strategy for increasing participation is capturing the satisfaction rates and success stories. Every time a wellness program or event wraps up, I would encourage you to ask participants, how satisfied were you? And do you have a success story you'd like to share? There is nothing like recognition, peer pressure, and some inspiration to get people to participate. And no one can argue with high satisfaction rates and real success stories. They often have potential to reflect your program's worth more than any ROI stat ever will. Speaking of success stories, I have asked two HEAL cities, Aurora and La Junta, to share their successes in terms of wellness policy, partnerships, and participation. Joining us first from Aurora is their wellness coordinator, Jennifer Hickey. She is here with me. Thank you for joining us. Can you first paint a picture for us of what Aurora's municipality and culture is like?
Yes, thank you, Liz. It's a pleasure to be here. The city of Aurora, it's the third largest city in the state, and we have roughly 4,000 employees. And we're, like many of those listening, widely dispersed throughout the city, which creates its own challenges. We have about 20 different departments, so all different occupations, to range from police and fire to streets workers. I mean, everything. So it's really diverse workforce, which I enjoy. Something unique to the culture of the City of Aurora is that we practice what's known as the Core Four. So 4 unique values that each employee strives to show in their daily work, those being integrity, respect, professionalism, and customer service. So that culture of Core 4 is kind of spread throughout the workforce. Great.
Can you share about Aurora's journey in integrating wellness into the culture and getting an annual program in place?
Yeah, it's been, a journey, of course, and taken different shapes throughout the years, but luckily been more robust the last 2 or 3 years since we've had a wellness coordinator in place. We really encourage use of our on-site resources. Luckily, we have things like the Peak Wellness Center, which is a fully functioning wellness center in the Aurora Municipal Center. So it gives access to employees 24/7 to use the gym. We also partnered with Kaiser to have a on-site employee health center that opened last year at the Aurora Municipal Center, so they can receive preventive care and services there. We do, fitness classes throughout the week at various locations. like many, the wellness challenges throughout the year, really trying to improve participation in those. We do health education classes, our open enrollment benefits fairs, which are really well received, and we have a very active workforce health committee, made up of various employees from different departments, and our carrier, Kaiser Permanente, we have representatives from there that come. So all of these things together really kind of, ebbed and flowed throughout the years, but I think in the last couple of years really have gotten more, a greater presence in the culture. So
Okay.
yeah,
Great. Congratulations on your new clinic, by the way, as well.
Oh, yeah, thank you.
Definitely moving forward then.
Mm-hmm.
So you mentioned briefly you noticed that your program is a little bit more comprehensive. Can you tell us a little bit more about your incentives? And can you tell us any strategies, if you have other strategies besides incentives, that have worked to improve participation in your wellness program?
Yeah, absolutely. So an exciting, rollout that we're doing for 2015 is, as we continue to build our culture of health, we're able to do what's called the Aurora Workforce Health Incentive Program, where employees have the opportunity to earn a $200 Visa gift card. So for incentives, that's been a really robust, meaningful incentive, and we've seen really great engagement so far. The program just began in March 1st. In trying to connect our resources to the incentive program, we're going to be doing an open house at our employee health center to promote the screenings that we're requiring for the incentive program, really trying to promote the clinic in relation to the incentive program, as well as our Peak Wellness Center for doing the physical activity challenge that's going on now called Health Trails. So trying to make it seem like an all-encompassing type of program, right at their fingertips is really kind of our goal, because we have resources for them. So I think the $200 incentive obviously is really meaningful, and employees are really excited about that. So being our first year to have that kind of an incentive, we'll see what happens. But I do see, almost 500 employees have already signed up for our platform in a month, so it's really exciting. Other strategies that don't include incentives are just kind of going back to providing what the employees are looking for, what they want. So I think just getting, from our needs survey we did a year and a half ago now, I believe, nutrition was a really high need and want from employees. And so I've been really trying to focus on nutrition classes and programming that really pulls participation, because it's what they had asked for. So I find anything around nutrition and eating well, automatically the participation increases, by 15-20% just right off the bat. So I think just giving employees what they're asking for has been really helpful in focusing on their needs.
Okay, that sounds great. It's nice when the wellness program is like core to all of those resources and can tie all of it together, so they'll let people know why you're doing everything.
Yeah.
It's just a refreshing view that simplifies it for employees. So kudos to you for doing that.
That's definitely been our goal. And we're still in our infancy around all of that, because our clinic has just been there a year. And although the Peak Wellness Center has been there since the building opened, we've seen a big jump already in utilization of the employee health center, so or the Peak Wellness Center. So I feel like people are starting to see all the resources that are available for them kind of right there. So even though we have multi-site locations, people do start kind of coming into the Aurora Municipal Center more than they were.
Good. Yes.
Which is
like it or not.
Like it or not, here it is. So they do see that connectivity, and that's kind of where we want to go moving forward, is trying to connect all the pieces to make it seem more comprehensive for them and convenient as well. So great.
So your program has obviously come a long way in just a few years. What partnerships have you really capitalized on along the way?
Yeah, so this has been a really exciting piece for me, just all the great partnerships we've developed for the last, so I've been there almost 2 years, and one big piece is that they did approve my position full-time. I was there part-time, So now that I'm there full-time, it's just obviously more time to devote to the wellness efforts, so that's been great. I think one of the biggest, so you mentioned Weigh and Win earlier, which has been such a wonderful partnership. We installed a kiosk at the Aurora Central Library, which is on the campus of the Aurora Municipal Center, and are now the 3rd top performing kiosk in the state at that location. So it's serving community as well as employees. We do have a drop down for registration, so employees can denote themselves as a City of Aurora employee, and we have about over 100 that have made that choice. I can't track them, but I know that they're there just from even talking to employees, and their engagement is good. So that has been really exciting.
Oh, one of our attendees has noted that she participates in Weigh and Win and hit her goal weight today. So congratulations.
Oh, fantastic. I have really, really loved it. I just got our quarterly update, and we've had 1,700 unique visitors at our kiosk and over 7,000 pounds lost at our kiosk in a year and a quarter. So it's just amazing what's happened there with the Weigh and Win. So that's one program I can absolutely recommend, and that you champion, because it's just great for the community, great for employees. They also do team challenges. You can see up on the slide. I promote the team challenges, and so our employees join a team. They can also have their family members participate, friends, so it's open for the community as well. So that really helps engagement if the spouse can participate as well. We've had some of our teams win, for top health points. It's just been so cool how engagement we've had around Weigh and Win. So it's been one of the best things the last year, I can say, for what I can see. So that's just, they also, and the incentives that are coming from the program, so kind of a nice way to capitalize if you are trying to incentivize. They did a healthy holiday challenge over the holidays where participants who maintain their weight, kind of like Maintain Don't Gain, which a lot of people do. Last year they did a healthy holiday challenge where those who maintain their weight, they got a $15 Amazon gift card. So I promoted that as well, and I had many employees sign up for that. So it's a way to kind of piggyback if you're looking for incentives, kind of using Weigh and Win. Why not?
And pay for them?
Pay for them. It's a free program, and it's just a great way to kind of, start using incentives that aren't coming from, maybe your budget. So that's been great. We were awarded the Walk and Wheel grant from Kaiser Permanente for the work site, so we're implementing that this year to increase work commutes by bike or foot, and kind of working to develop more of an active commuting culture. So that's been exciting, the Walk and Wheel grant. And other partnerships, include, obviously LiveWell Heal, the Colfax Marathon. We partnered with the Step Out Stop Diabetes Walk last year, the Aurora Mental Health Center in the area, Prostate Conditions Education Council has done screenings at the Aurora Municipal Center that work for community as well as worksite. And also partnering with Lula's Cafe, which is in the Aurora Municipal Center, to offer, partnering with the restaurant owners to offer more light menu items, and those items have been subsidized by the wellness budget to keep prices the same for employees. So, yeah, we've just been busy.
Yeah, you guys have been doing a ton. We've shared many great things about your program and your partnerships and how you're getting participation. Do you have any last thoughts regarding policy, partnerships, or participation that you'd like to say?
I think, and this is really, I think, in the field being talked about more and more around the senior leadership support, and really gaining that level of trust amongst senior leadership and education around how they can be developing the culture. So I've been talking a lot with our management leaders, everyone from mid-level and up, kind of really having their support for the frontline workforce has made a huge difference. So trying to explain, our wellness program, why we're doing this, and getting their buy-in has made a huge difference in the last year, I can say. And kind of creating those relationships, where it's not just wellness over here as a separate program, but integrated and on many different levels, to organizational development, to integrating more with the benefits plan, the health plan, as opposed to just a standalone program. That's kind of where we're moving. So I think that's has made a big difference in the last year for us.
Okay. Well, thanks. Well, now, joining us from La Junta is Dawn Block. She's been with the City of La Junta for 27 years, and she wears many hats, including coordinating human resources, senior center, transit, and grants. She's also an active member of their Wellness Committee, which is the group you see on the slide. She's the second from the right. So Dawn, can you paint us a picture of what La Junta's municipality and culture is like?
Sure. La Junta is actually located 60 miles east of Pueblo, southeast corner. We're a community of about 7,100 people, and our service area is about 50,000. We are the agriculture, ranching, and railroad hub for southeast Colorado. We enjoy our beef as well as our watermelons and cantaloupes in the fall. We also have traditional Mexican food restaurants, which makes the healthy eating a little tough sometimes.
Okay.
The move around healthy eating is gaining. Over the last decade, we've seen an interest rise in healthy eating and the active living. The City of La Junta has 135 employees. We have a diversified workforce. We have public safety, public works, as well as clerical. The employee wellness program is growing. We have 58% participation rate in a voluntary program, so we're pretty excited about that. And we've just recently partnered with the Southeast Health Group to create Mud Sport. It's a 5K run down our Aurora with obstacles, and then you cross the Arkansas River. So this year's event is April 25th, southeasthealthgroup.org to register.
Okay. Can you share what you've been doing to formalize La Junta's wellness program and embed wellness into your culture?
Sure. La Junta is currently in the last year of a 5-year pilot project that was free with Pinnacle and Trotter Wellness. A wellness committee was formed 3 years ago to help direct that existing program. After some discussion with the committee and our city administration, we decided that at the end of our 5 years we would drop Pinnacle and Trotter Wellness and start on our own. So with help from Liz, we have adopted a charter and an operating plan. We have just this week put out our employee interest survey, and those results will be used to guide our next wellness year. We have posted the Use the Stairs posters, and we have established some walking paths in our downtown area for employees to use. And we offer free health screens through the Otero County Health Department twice a year. And again, like I said, we have 58% participation in a voluntary employee wellness program.
Okay. The people who aren't participating, I think, are missing out, Dawn, because we've been doing a lot. So La Junta was recently highlighted in the March HEAL newsletter for your great walking program. Could you tell us how you went from 20 participants to over 80 in just a year?
Oh, for the past 2 or 3 years, the employee wellness program has had several walking challenges, like Walk Across America, and we walked Highway 50, and had wonderful participation. So at the Senior Center here, we decided that we would copy that program and make it a year-round program in 12-week increments. So in January, we combined the city program and the community program, and we post our results on the walking wall. The only thing that you have to participate is a pedometer, and you have to call into the Senior Center once a week and report your steps to one of the staff members. And then we track the progress across the wall. We have incentives at different milestones. One of our local newspaper reporters is a senior center member, and she started in January. She wrote 3 articles in the newspaper, and our participation quadrupled. We think, the committee thinks that it's because people need to be held accountable, and even if it's just picking up the phone or coming in and reporting those steps, makes them a little more responsible. It's kind of nice to see your picture on the wall. As you can see in the slide, we have several little people there, and those move across the wall as you progress. Our little reporter writes update article every few weeks. I think our incentives have been a huge part of this program also.
Okay, so it's fun, it's simple, and people can really use it as their accountability. That's great. So in addition to that unique partnership with the newspaper, writing articles every couple weeks and quadrupling your participation, do you have other partnerships that have contributed to the success of wellness at your workplace?
We do. LiveWell, Colorado has been one of our greatest partners. They've helped us with policy and formalizing our program. The Otero County Health Department Smoking Cessation Program has helped with funding some of our incentives. The community as a whole has been incredibly supportive. And we are in the process now of registering with HealthLinks. So we're looking forward to an active partnership with them also.
Okay, great. Do you have any last thoughts regarding policy or partnerships or participation that you'd like to share, Dawn?
Well, buy-in from the top is the most important. We're fortunate that our city manager is physically active and health conscious. The Wellness Committee has had his support for all of the things that we've asked to do. Also, don't recreate the wheel. Most organizations that have a successful program are willing to share those programs. Ideas, materials, forms, there's no sense in having to come up with that by yourself. All you have to do is ask, and they'll usually share that. Again, the community support is amazing. We never imagined that it would have turned into anything like it has.
Okay. Well, thank you so much for sharing, and I think it's neat what you said, that people who maybe have a program or a resource that's really helpful for them are willing to share that. And I don't think you got a degree in health and exercise science, perhaps. Like,
no, I didn't.
Jennifer, but you are, you know, able to just do a lot for the health of your employee population as well as your community, and so that's great. And I think both you and Jennifer both mentioned just the importance of that senior level support. So I guess thinking way back to slide 2, it's no wonder really that capturing senior level support is really one of those vital components to having a vital worksite wellness program. So thanks for sharing that as well. So now that we've heard from very different municipalities regarding their policy and partnerships and participation strategies, I just want to take a quick moment and allow the listeners, you guys on the phone, to comment or ask questions before I wrap up with a few more slides. So at this time, please feel free, if you have questions, to type it into the question box, and we'll do our best to answer.
Well, previously in the presentation, one of our attendees asked about how we define culture. Liz, maybe while we're waiting for other questions to come in, you can talk a little bit more about what it's like to change an organizational culture and how you define that word.
Okay. That's a really good question. I guess culture for me, when I was working at Larimer County, really was just kind of the feeling that employees had when they came to work, and the fact that employees could kind of depend on something when they got there. And so culture being that they could depend on employees that were upbeat and people being supportive and not getting in the way of the life that they were trying to lead, if it was a healthy life and they didn't want to have things put in their way. So there is just kind of this feeling of either energy and support at an organization, or there's kind of this feeling of being stressed out and perhaps overworked or, you know, overwhelmed with work. And I think culture can do a lot for a person and their health and how they work. And so culture to me, I guess, is just kind of wrapped up in those types of descriptions. It's just that feeling of the work site and whether or not it's a place that people want to come to work because they can thrive there versus coming to work because they have to get a paycheck.
Great, thank you. We do have a couple of other questions coming in now. Carrie asks, how do you or how did you get buy-in from the top? I know all of our panelists today have talked a little bit about this. How do people at the top provide support, and are their contributions consistent?
That remains to be seen. That's a really good question. So I think it has to do with, I think the senior leadership, they can shift and they can change, and it's, you know, for Aurora, I can speak to right now, there just seems to be a lot of people in place that have created the environment, like the culture now that we have, and it's a very fortunate coming together. Our city managers very supportive, our deputy city managers, but you know, that doesn't just magically happen. They have to feel it themselves, and so it's one of those where the leaders are in that place. They want to provide the support once, you know, the case has been made, all the data has been shown, you know, it's kind of giving them what they need to make those decisions, but ultimately, you know, I don't know that magic way they decide that, but for whatever reason, the people we have right now all, you know, got behind and kind of, you know, agreed. And so I think it's such a hard one, because in my, you know, tenure, I've seen that not happen as well, where things can get changed when all the data's there and all the, you know, you think it's going to be a sure win, it's not. And so you have to do a lot with the people that you have in those roles and how they view it in their, you know, their background, their personal beliefs. It's, you know, it's how I feel like that's a really tough one. And I don't have the answer exactly, but it's just providing everything you can, showing the enthusiasm, trying to have the data to support it, and hopefully the people who are in that decision-making role can see the value and, you know, want to move the organization in that direction. And that's why I feel like managers do play a huge role in culture, because they're the ones driving these programs or culture that we're looking for, a workplace of health, or they're the ones kind of impeding it. So it's like kind of the $10,000 question in my mind. But and as far as being consistent with contributions, I've seen that go many different ways. You know, being in municipality, public sector, it's hard around budget, and that's why we're, you know, our goal is to try to build more of a sustainable program that isn't just based on, you know, year-to-year kind of things. But you know, I've seen the support now from Aurora that I believe it will be consistent. So that's my hope. But I don't know, any thoughts on that from you, Liz? That's a hard one.
Well, thanks, Jennifer. Real quick before I pipe in, Dawn, do you have any experience with that question that you'd like to share?
Well, I think peer pressure plays an important part too. We fortunately didn't have to use that with our city manager, but if we have a lot of employees that are very interested in this, and I think that also helps sway your senior management. And our city council has been very supportive, and ultimately they're the ones that decide the budget, and so we've been fortunate that we've been able to have a dedicated budget for 5 years.
Great. Yeah, that's great. Definitely. I guess just this is Liz again. The final things that I think I would add to that, or perhaps just reflect, is the fact that leaders are in a tough spot, and so are like the middle managers. They're kind of in a tough spot of needing to get a certain amount of work done, and then trying to support wellness and let people to go to certain wellness things as well. So I think middle management should be kind of a thought of when we're talking about this as well. But one, it takes a lot of times data, to kind of back your program at the beginning. And that is why I wanted to put in those 3 or 4 slides at the beginning of this presentation. You will be given this slide deck, and it will be sent to all participants, and it is being recorded. So you can go back, and I have the references there for you. Those articles are pretty easy reads and, worthwhile if you need to make a case for something, such as workplace wellness to leaders. Also, kind of like what Jennifer was saying, they kind of have to, as a leader, it needs to hit home with them personally. At Larimer County, I was thankful to have Frank Lancaster, who's now in Estes Park. But at the time, when I started at the county in 2008, he wasn't at the peak of his health. And within about 4 years, he turned his life around, and I know he'd be okay with me sharing because he shared it in public as well. But he lost 70 pounds, was back down to his college weight, and just put on his calendar every single day that he needed to exercise. And he wrote an article for all the employees that said, you know what, I put that on my calendar, and it was an appointment I didn't miss. And so it just hit home, and I think we have to realize that leaders are in a unique position with being in the public's eye, and yet at the same time they're people and they have hearts, and their success stories, when it hits home for them, can just do wonders, much more than any stat can do. Going just back to the fact that people are real, and this sometimes can just hit home with them. So I guess those items are just the last 2 things that I would add to this conversation.
Hey everybody, this is Julie George. I'm the director of the Hill Cities and Towns campaign, and I've just been sitting here listening. I'm not obviously a presenter, but I did want to respond to Carrie's question just briefly. So one of the reasons that the campaign requires a city council to pass a resolution is so that you as staff have that elected buy-in as well. And the resolution is important. You can go back and look at that and see what goals are put in there. And I think that's a tool you can use with your leadership as well. As you as staff are trying to move some things, you can point back to the resolution and point back to the fact that your municipality joined the campaign and that it was important to your city council. And so, use it in that regard if that can be helpful. So I just wanted to add that in there.
Julie? All right, thank you. We have another question. Eric says, we do not have a city recreation workout facility. How might we go about partnering with a local exercise center? Does anyone have any thoughts or experiences to share?
This is Liz, and Eric, at Larimer County, we did not have a rec center either. And so the option that we used was going to the various workout facilities in Fort Collins and Loveland and Estes Park, and we expanded it to workout facilities as well as yoga centers or Pilates studios, and we just asked if they would give us some sort of discount because we were county employees. And then we had a list, and the list was about 3 pages long because most people wanted to be on this list with their business. And then we shared that with employees. And so we would just share in one column what this regular rate was at a workout club, for example, and then the discount that they would offer to employees and potentially family members. And so that was our workaround. At the county, it was a self-funded plan, so it was a lot trickier to pay for gym memberships. So we never were able to get that done just because of the taxation and the logistics around that. But it was at least an option, and it showed our employees that we were trying to get them a discount, and we recognized that it was important to them to have some sort of access to a fitness facility. at a better rate. And Julie has another suggestion.
Oh, hey, it's Julie again. So Eric, I can't tell what municipality you're from, but in some of our smaller communities where they don't even have the option of a privately run, workout club, there has been some good success with working with the local school district and using intergovernmental agreements to get access to maybe the weight room, or for the city to bring some programming into and using a space, the school, maybe the high school gym, to run some sort of class, like a Pilates class, or whatever is popular in your community.
Zumba?
So yeah, so look at that. That's an option to look at as well, and we have resources that we could help with. Sometimes there's this perception that it's hard to do an IGA and that there's liability issues, and those can be overcome. So that's another option, especially in our smaller communities that either don't run rec centers themselves and also maybe don't have access to private clubs.
Thank you.
We'll take a few moments just to answer any last-minute questions. Please feel free to submit those. We do have a couple of minutes. We don't have any others coming in at the moment, so I'll turn it back to Liz if you have any closing thoughts or anything.
Okay. Well, for closing thoughts, I guess I will just wrap up with this statement. The key to a successful worksite wellness program capable of sustaining behavioral change is the creation of a culture and environment that supports health and wellness. And while it doesn't happen overnight, a healthy workplace culture does develop over time with the help and support of people like you. So be strategic in your program planning and diligent in your wellness policies. They lay the groundwork for your program and really help make the healthy choice the easy choice. Capitalize on partnerships as well. They sustain and energize your program and you. And last but not least, capture better participation with both leadership and grassroots support, incentives when necessary, and satisfaction and success stories always. If anyone is interested in furthering this discussion, getting access to the resources that I've shown during this presentation, and/or receiving technical assistance for a healthy workplace, please contact me by phone or email. I am the Healthy Workplace Technical Assistance Provider for this campaign, and I would really be happy to help you tackle and lessen these cultural hurdles. So on behalf of LiveWell, Heal City and Towns campaign, and myself, I want to thank you again for joining us today. Thank you.